Assalamualaikum warahmatullahi wabarakatuh. My name is Ain. So today I would like to present the nutrition management for retroviral disease, which is HIV. For table of content, first I would like to present on nutrition assessment. Next will be nutrition diagnosis, and then nutrition intervention and nutrition monitoring and evaluation. For nutrition assessment, for the client history, patient is Mr. TL, 32 years old, male Chinese. Patient is diagnosed with retroviral disease, which is HIV, and diagnosed 4 years ago with sore mouth and throat. For social history, currently patient is not working, but previously patient worked as a medical assistant at HUKM. Patient have history of intercourse with multiple partners with safe sex precaution. For medical history, previously patient has undergone tonsillectomy, which is 6 years ago, and undergoes appendectomy 18 years ago. For family history, patient's father have hypertension and cardiovascular disease. For anthropometric measurement, the height is 168 cm, the weight is 48 kg. For the weight history, patient is weighed 52 kg for the past 1 year and 62 kg for the past 4 years. And there are 8% weight loss in 1 year, which is not significant. For BMI, BMI is 17 kg per meter square, which is considered as underweight. And for ideal body weight, by using BMI 22.5, patient weight is 63.5 kg. For biochemical data, for the first is for liver function test, which shows that the albumin and total protein are normal. However, for total protein, it is at the low borderline. Next is food blood count. For the white blood count and hemoglobin are normal. For HCT is normal but at the low borderline, and for viral load is higher than normal range. For CD4 is lower than normal range. For CD8 is lower than normal range, and for lymphocyte percentage is low. This is the medication that have been taken by patient. For nutrition-focused physical findings, shows that patient physically looked thin, and patient reported to have sore mouth and throat. And the vital sign is first is the temperature, which is 37 degrees Celsius, which is febrile. The blood pressure is normal. The heart rate is 92. And for the stool test, which shows that patient have HIV negative. This is the food and nutrition related history. And overall, patient estimated calorie intake at home is around 810 kilocal per day, which is around 43% from the requirement, with 61% of carbohydrate, 15% of protein, and 31% for fat. And based on patient intake, shows that patients tend to take small portion of meal for breakfast, lunch, afternoon tea, and dinner. And patient have low fiber intake. Patient can only tolerate a small amount of meat at one time, and patient reported does not like to eat fish and drink coffee. Okay, for dietary requirement, first is energy requirement. By using quick method, which is using ideal body weight of 63 kg times with 30 kcal per kg, shows that patient energy requirement is around 1900 kcal per day. Next is using Mifflin Sanjur by using current body weight with 1.1 activity factors and 1.3 stress factors, shows that patient energy requirement is around 2000 kcal per day. For protein requirement, based on Aspen 2006, the protein requirement is around 1.2 gram per kg body weight times with ideal body weight, which is 63 kg, shows that the protein requirement is around 75.6 gram per day. Next is blood requirement by using Bromid O 2002 formula. The requirement is around 1920 ml per day. Nutrition diagnosis is inadequate oral intake related to decreased ability to consume sufficient energy due to poor appetite, as evidenced by estimated calorie intake at home is around 810 kcal per day, which is around 43% from requirement, which is lower than requirement, which is I choose 2000 kcal per day. For the nutrition intervention, first is the objective. The first objective is to optimize energy and protein intake by providing high protein diet and oral nutrition supplement. Second is to improve nutritional status by preventing from further weight loss. The nutrition intervention plan is to indent high protein diet by providing one boiled egg for breakfast. Second is to encourage patients to take small but frequent meals for breakfast, morning tea, afternoon lunch, afternoon tea, dinner, and supper. The third one is to encourage patients to take nutrient and calorie-dense food, for example, yogurt, fruit pudding or jelly, juices, or peanut butter cookies. And the fourth one is to prescribe oral nutrition supplement, which is 4 scoops of Fancier Gold with 1 sachet of biotin with 150 ml of water. 3 times per day, which is for morning tea, afternoon tea, and supper, that will provide around 591 kcal and 36 grams of protein. Next is to encourage patients to eat and drink chilled or room temperature food as patients have sore mouth and throat. And last is to encourage patients to eat his favorite food in order to increase patient dietary intake. For nutrition monitoring and evaluation, first I would like to monitor on the weight changes, which is a weekly weight changes. Second is to monitor on dietary intake of and compliance of to an ONS. And the third one is to monitor on biochemical data, which is FPC and CD4. For the discussion, research shows that the prognosis of advanced HIV infection is influenced by undernutrition, where undernutrition will correlate with increase of mortality. So it is really important to make sure that patients have an adequate intake of or have adequate oral intake. Next is the target protein for intake should be around 1.2 in a stable phase. Or it may be increased to 1.5 during acute illness. This is based on Aspen 2003. And nutrition supplement, including amino acid, a mixture of arginine, glutamine, leucine metabolites, beta-hydroxy beta-methyl glutarate, can promote increase in CD3 and CD8 lymphocyte count and decrease in the HIV viral loads. That's all from me. Thank you.